Well, hello, welcome everyone. Today we'll be discussing breastfeeding and health awareness during, before, and after breastfeeding. We're going to be discussing some key facts from the mothers and families. We'll talk about some local support resources here in Charlotte, North Carolina, and a quick reference page. As you all will see, I have given you guys a brochure here that I've made that will allow you to be able to get the information, all your resources and stuff on the back. You can open it up. It's just one page and it has all the statistics and important information about breast health and how it correlates with breastfeeding. Okay, you can follow along with me as I go through the slides. As an introduction, just want to let you guys know the breast health is essential for mothers and infants throughout the breastfeeding journey. Awareness and proactive care can prevent common breast issues and support successful breastfeeding. This presentation, like I said, is going to cover breast health before, during, and after breastfeeding with practical tips and statistics and cultural considerations, myth, workplace support, and other information that will be very beneficial to you all. Now, breastfeeding, it's not just about feeding your baby. Breastfeeding is about a lifelong health for the mother and the baby. When mom is pregnant, she'll be caring for the baby. And likewise, when mom has the baby's going to in turn help her because breastfeeding will help to shrink the uterus back down to its normal state. And getting mom's bleeding under control, which is so important right after a delivery. It reduces several diseases for the mother and the infant. And for mother, we'll get into that a little bit more. And for baby, we'll get a little bit more information about that as we go through these slides. Although the mother has faced challenges, it can impact breastfeeding. And we'll discuss that in further detail as well. If you look at the slide here, breastfeeding reduces the risk of breast and ovarian cancer, type 2 diabetes, and high blood pressure in mothers. Who would have known that those things would be corrected or reduced just from breastfeeding your baby? For infants, breastfeeding lowers the risk of infections, asthma, also diabetes. That was something new for me. And sudden death syndrome. Most of you guys know that as SIDS. And that is when the baby is laying in the bed and they fall to death because of when they're sleeping. I'm not going to go a whole lot of detail into SIDS, but that is one of the number one causes of infant death. Is SIDS in the baby's crib. Over 83% of our infants start out breastfeeding, but only about 56 of them are still breastfeeding at the age of 6 months. That was very impressive to me. Just 25% of them are exclusive to breastfeeding up to 6 months. And we're going to go to the next slide. Now let's think about breastfeeding before you have the baby and before you get pregnant, in your preconception and your prenatal care. Regular self-exams. I don't know if you ladies are doing your breast exams when you take your shower, when you take your bath, even when you're just laying down in the bed. You want to make sure that you're doing those self-examinations as well. Don't just wait till your annual when your doctor does the exam for you. You want to do that for yourself, and you want to get really familiar with your body so that when you're pregnant, you can see those changes to your breast as you are during your pregnancy and what it looks like after your pregnancy. So that way you can tell if you have some abnormalities there. So that's very important. Prenatal classes and discussions with your healthcare provider if you see any changes that you think are abnormal, but it may be normal during pregnancy. So you want to make sure that you know your body so that you will be able to tell when there is a change going on there. Going on to the next slide, we're going to talk about what the breasts look like during pregnancy. With hormone changes, like I said, with those hormone changes, your breasts will be changing. There will be no breasts that stay the same and look the same as it did prior to pregnancy and what it looks like after pregnancy. there will be some changes. So you guys be on the lookout for that. We just want to let you know that there will be some changes. Some of those changes are the growth, tissue growth, increased sensitivity like to temperature, to touch. You also have some darkening around your areola, and that's all normal. It will seem like it went from a quarter size to a $half size or even larger, and that's okay because everyone is different. But that is a noticeable change that you will see in your breast once you are pregnant and as you further along in your pregnancy. Your breast will increase about 1 to 2 cup sizes. Every woman is different, but it will increase 1 to 2 cup sizes on an average. Some of them get a little bit even bigger than that, and that's okay as well. The bigger your breast is, the more capacity that milk will be produced and you can hold in your breast. That lets you know that your body is preparing for milk production. Okay, that means it's time to feed our babies, honey. It's time to feed our babies. Let's go on to the next slide. We're going to talk even more about what's happening during breastfeeding. You want to make sure that when you are breastfeeding, know that you always have resources, okay? We have resources that you can use and that will help you to be able to breastfeed your baby. The best thing you can do is learn how to do it the correct way, get the practice that you need so that you can provide the feedings to your baby without injuring yourself, because there is a technique to it. There's several techniques to it. There's different positionings that you can use so that you won't hurt yourself or your baby when you're trying to breastfeed. Okay, ladies? Monitor for early signs of issues with your nipples. If the baby doesn't latch on well or latches on the wrong way, it will hurt. It's not meant for breastfeeding to hurt. However, it'll be a bit discomforting, but it shouldn't hurt if the latch is on correctly. Okay, ladies? Common breastfeeding issues and prevention. Many mothers experience some nipple soreness, just like we just talked about. Engorgement. If you don't know what engorgement is, that's when your breast milk is coming in and it's not emptying out as fast as it is being produced. So with that, you want to make sure that when you're breastfeeding, you want to alternate from right breast to left breast each time with your feeding, so that you won't have one breast that's bigger than the other, because the one that's getting really, really big and it's not draining out, you may have a blockage in your duct or something like that. But that stretching of your skin, stretching of the follicles in your breast, your lactation ducts, that's going to start hurting you. If you ever experience that, what you want to do is get a warm cloth, make sure it's warm as you can stand it, put it on there so it can open up your ducts and it will let that milk flow out. Or you want to let baby latch on to empty you out. Okay? Early intervention, continued breastfeeding is key in resolving most of these issues. Okay? Like I said, if you look at the slide, blocked ducts, mastitis. Mastitis is when baby's breastfeeding and you're not cleaning your nipple after every feeding. Now, you want to clean your breast after every feeding so that there won't be any bacteria that came out of baby's mouth that is lingering on your breast, and it ends up being like, I don't know if any of you guys ever heard of thrush, but you can get thrush on your breast as well. And that is a very painful situation if you get that. So you want to make sure that you're cleaning your breast thoroughly after baby breastfeeds and drying it really well. You don't want your breast to stay wet. You want it to be clean and dry. If you have some irritation, you can use lanolin cream. Excuse me, I'm having tongue tie. But you can use lanolin cream, and that will help to keep your nipples not too dry where they're cracking, but the normal consistency of moisture that your body needs to have. Okay, ladies? Moving on to the next slide. After breastfeeding, when you're trying to wean your baby away from breastfeeding, you want to do it gradually, okay? You want to do the gradual weaning because it's going to be a shocker to your body as well, okay? Weaning can be gradual and to prevent that engorgement and mastitis, okay? Continue doing your breast exams. Even though milk is being produced, you still want to do those breast exams because you shouldn't feel something that's hard, like a nodule, um, or like a little ball or a marble. You shouldn't feel those things. But if you do, you want to let your provider know that you feel those types of things. You want to maintain a healthy lifestyle and support that long-term breast health, okay? Um, Now we're going to talk about cultural considerations. With every culture, everything is different as far as health, emotional stuff. Um, every culture is different, and that's okay. Cultural beliefs and practices greatly influence breastfeeding. Some cultures don't believe in breastfeeding. Some of them are strictly breastfeeding. Initiation rates and feeding practices vary in the community. So you want to be mindful of that. Whatever your culture is, if you want to follow your culture, you can do that. If you want to adopt practices of another culture, that's totally fine too. But like I said, you have lactation consultants, you have supportive resources that you can use to allow you to experience all those other um, techniques, okay? It's important to respect other people's culture and understand the differences within the cultures and how sensitive that topic can be. Avoid stereotypical comments or behaviors. If you look at the slide here, on that second statement, breastfeeding initiation rates vary wildly by the culture and the ethnicities. For example, in U.S. rates range from 74.5% among Black African Americans mothers and 94% among the Japanese mothers. Some of those barriers that we talk about as far as culture ranges from the stigma, the lack of support, or just not knowing how to do breastfeeding as a whole. Yes, and that cultural competency providers and peer counseling that helps to improve um, outcomes for moms that want to breastfeed. And like I stated earlier, just having the best practices, avoiding those stereotypes. Use an interpreter if you don't speak English and you need an interpreter for someone to show you how to do it correctly. Please make sure they get an interpreter for you to give you that best practice. Okay, going on to the next slide, we're talking about statistics. When people are breastfeeding, that saves over 820,000 children's lives. Okay, every year, children from the ages of 0 to 23 months, when they are optimally breastfed. Okay, it lowers the risk of SIDS by 36%. It lowers 64% of gastrointestinal infections and also 72% of hospitalizations for respiratory infections. So when I talked about earlier the things that it does benefit for the baby, it benefits the baby because it lowers the risk of RSV, ear infections, asthma, and any type of gastrointestinal problems. So each month of breastfeeding reduces risk of childhood obesity as well by 4%. So it's saying that every month that a mother breastfeeds that baby, it saves that baby the risk of getting obesity by 4%. Okay? And again, like I said, for mothers, it helps to lower the breast and ovarian cancer, high blood pressure, type 2 diabetes, stroke, and heart attack. Those are all things that breastfeeding does to help mom and baby. Moving on to the next slide. There are a lot of myths about breastfeeding, and we're just going to talk about a few of them. But I want you to know that these myths about breastfeeding is not always easy, and it's not always pain-free. But support is available, like I spoke about earlier. The size of your breast. It does not matter what size your breast is. You guys can read the screen to see what the PowerPoint says about the myth and what the facts are. And I also have that in this flyer that I gave you with the statistical facts and stuff in there, okay? So it doesn't matter what size your breast is. Some people think that, oh, my breast is not the right size, I won't produce enough milk. That's not true. That's a myth. So the breast size doesn't matter and it doesn't affect your milk supply. And most often when you're eating different types of food, They say that certain foods you can't eat if you're breastfeeding. That's not necessarily true, because most foods are safe. But what I will say is not drinking alcohol, doing illicit drugs. Those are things that will affect your baby when you're breastfeeding, okay? Even if you get sick, some people say, oh, you can't breastfeed because I'm sick. That's a myth as well. You want to go ahead and continue breastfeeding so that your baby is getting the nutrition that it needs, okay? And also prevents you from getting engorgements, okay? Moving to the next slide. Economically, breastfeeding has saved families an average of $1,200 to $1,500 a year because they're not buying formula. So it saves families so much money. It's beneficial to the society by reducing medical expenses because the baby doesn't have to go to the hospital for RSV, doesn't have to go to the hospital for asthma or ear infection. So it saves families money for that as well. Breastfeeding alone is an environmentally safe and friendly practice to have. It reduces waste and also it saves energy. Okay. If you also look at the slide on the third bullet point, increased breastfeeding rates could save the U.S. economy at least $33.6 billion per year. Per year. Okay. And look how much it saves with medical expenses. $100 billion. Who would have known that breastfeeding will help to reduce so much in the economy as well as within someone's household? That's something to really think about. Going on to the next slide, you have some support groups here. Your breastfeeding support resources. You can read this also at your leisure. It's on the brochure that I sent out as well. And that is something that you can take home with you. On the back of that brochure has all of the contact information for these resources for you guys, okay? A lot of mothers also decline to breastfeed because they have to go back to work and they think that they can't go to work because they won't be able to pump and breastfeed. But the federal law tells you now that you should be able to breastfeed at work. It protects you from breastfeeding issues with your employer. It should provide you break time and a secluded area, isolated area for you to be able to breastfeed or pump. Okay? Supportive workplace benefits from both employees and employers. You need to know your rights and communicate your needs when you need them, okay? I do apologize for that as well. Here's the PowerPoint again. Breastfeeding and reduction of breast diseases. Like I said, it helps to reduce so many different types of cancers. And for the mom, it reduces risk for breast cancer by 4.3% of every 12 months of breastfeeding. Women who breastfeed for more than 12 months are up to 26 to 28% less likely to develop breast cancer. Other breastfeeding benefits, it helps to protect other breast disease. The key statistic, mastitis affects about 10% of breastfeeding women. Breast abscesses develop 0.4 to 11% of mastitis cases. Benign breast lumps, fibroadenomas, and cysts are common and do not prevent future breastfeeding. That's on slide 16. I will also send you guys a copy of this link. I do apologize that I couldn't let you see all of it, but I will also give you a copy of the link that you can go back and read this in this leisure. But like I said, all the information that I have is on the flyer and brochure that I gave you, okay? Anytime you have any issues with your breast, when something seems abnormal, like I spoke with you about earlier, you want to make sure that you seek medical attention, okay? Any unusual lumps, any discharging, any things of that, any signs of infection, if you start getting a fever, chills, or flu-like symptoms, and you are feeling the heat in your breast, you want to make sure that you contact your provider and get that looked at. Anybody have any questions right now? Common questions on the 18th slide. There's common questions like how long you should breastfeed. They recommend that you breastfeed for the first 6 months with continued breastfeeding along with complementary foods for at least 1 year or longer. And people ask, does the breast size affect milk production? It does not. As we spoke, that's just a myth. That does not constitute how much milk you are going to be producing. What are the signs of a good latch? When a baby latches on the proper way, there shouldn't be any pain. The baby's mouth should be wide open. The chin should be touching the breast. It may look like the baby is smothering. The baby is not smothering if they're breathing. Okay? Make sure the baby's mouth is open when it goes onto the nipple as well as part of the areola. That's when you know that they're going to get a good mouthful and they won't just latch onto your nipple, because you don't want them to latch onto your nipple. That would be very painful. And if you keep doing that, it will cause irritation and some cracking to your nipples. Okay? So we want to avoid that. And there's another question, what should you do if you have a lump or pain? You continue breastfeeding, use warm compresses, and consult with your health provider if the symptoms still persist. Because a lot of times that pain comes from engorging. So any issues that you may have or that you may be feeling, please let your provider know. Can I breastfeed if I have flat or inverted nipples? Yes, you can. So like I told you before, there's different techniques that you can use. There's nipple shields that you can use that come in various sizes, size 21, 22, and 24. And you want to make sure that you ask for one of those. If you have inverted nipples, that means that your nipple goes inward versus outward. Ask for a nipple shield, and what that does, it places right on top of your nipple, and as the baby latches onto the nipple shield, it'll pull your nipple out. So there are still ways that you can breastfeed even if you have an inverted nipple. Okay, ladies? Any final thoughts? I know that was a lot of information, and I'll be around here to answer any questions that you may have. Also, my colleague, the lactation consultant, will be here also to answer any questions that you have. When you do come to have your baby, she'll be reaching out to you, coming to your room to talk to you, and she'll be able to direct you in the right way for us, the positioning of your baby, how to get your baby latched on properly, and all of those things. But I want you to understand, and I want you to be confident in knowing that breast health is a lifelong journey. The awareness and proactive care is always key. You're not alone. So seek attention, seek support when you need it, okay? It provides benefits for you and your baby. Thank you guys for being here, and thank you for listening to me and gathering this information. Again, I'll be around here, and if you need me for any questions or you have questions about anything I said on the PowerPoint or in this presentation, please let me know, and I will get you the answers, or I'll provide those answers to you the best of my ability. Thank you. Have a great day.